What is hemophilia? Hemo means blood, and philia means love, so hemophilia means loving to bleed. Our blood must flow at a certain viscosity. If it flows too thinly, it leaks out, it causes bruises, or it bleeds into your urine or even into the brain. But too thick and it clots, it causes blood clots that get into the lung, or it can cause strokes. So you have to have your blood just at the right viscosity. Hemophilia occurs when there's a genetic defect in one of the 14 clotting factors. It's genetic. One has to be born with it. It's not acquired. You just don't get it from infection or from getting older. It's a genetic defect in the clotting factors. Historically, England's Queen Victoria had hemophilia. Hemophilia of her type was a factor IX deficiency, and it was an X-linked deficiency. So all of her female children, half of them carried the gene, and of the men, half of them would actually have the hemophilia because they got the X-linked part. So none of the women would have any signs of hemophilia, but all the men half the men would have hemophilia and half would not. The most common type of hemophilia was named by Dr. von Willebrand, and it is called von Willebrand's hemophilia. It's a defect in factor 13. And it's a dominant, autosomal dominant. So if either parent has it, half of their children will have the hemophilia and half won't. In adults, or even in children, the most common presentation of bleeding is in the knee. The knee joint will bleed, it will swell up, it will be very painful. But in young children, maybe infants, it can commonly show up as a head injury. Children fall, hit their head, it'll bleed inside their head. Or famously, circumcision. If the child has hemophilia and the boy is circumcised, it'll just keep bleeding and bleeding and bleeding. In fact, there was a tale in Jewish history. The family had 3 male children, one after the other. After circumcision, they all died, and so they petitioned the rabbi to not require circumcision for future boys, and they got that permission. Treatment for hemophilia comes from transfusions of these clotting factors. Now, the clotting factors used to be made up by plasma. They would take a lot of donors in their plasmas, concentrate down the clotting factors, and give those specific ones that the patient needed for their disease. Plasma, unfortunately, is the place that carries a lot of viruses. So around the 1960s, there were a lot of hemophiliacs who were getting transfusions that were contaminated with HIV and hepatitis and caused a lot of deaths. And it wasn't until like the late 1980s that they were able to really clean up all those plasma donations. Nowadays, it's not nearly as much of a problem. It's not a problem at all because all the clotting factors are made by genetics and not made by human donations at all. So no more danger in getting the transfusions. At this time, there's no cure for hemophilia because it's a genetic disease. However, there are treatments under consideration, such as bone marrow transplant, and there's work with the CRISPR machines that can actually change a person's DNA, maybe insert the correct gene to get rid of that hemophilia to give it enough clotting factors. This is Philip Levin with a short medical video. Please subscribe and check out my website for my books.